Greetings. These days, with the COVID-19 pandemic raging, we're told that we should wear masks and observe social distancing, and that we should avoid indoor meetings where we're not spaced well apart or that last a while, and where many people will not be wearing masks. Workplaces, schools, and churches are closed in the name of protecting public health, which I think is a good reason for their closure, whether one thinks it's a sufficient reason or not. But there seem to be some people who perceive such measures as undue interference with their personal freedom, or who see COVID-19 as made out to be a much greater threat than it really is, simply to further a liberal attack on conservatives' exercise of their fundamental freedoms, including the freedom to work or the freedom to practice their faiths. I fear I can't really do anything to sway those who think of COVID-19 as a hoax. I can only point them to the statistics on cases and deaths and ask them if they really think that President Trump would have allowed the partial shutdown of the economy for even 1 minute had he seriously thought it was a hoax, while also pointing to the audio tapes of Washington Post reporter Bob Woodward conversing with President Trump, tapes in which Trump admits to knowing that the pandemic was real, to knowing that it was airborne, and to knowing that it was more deadly than the flu. In his odd wording, more deadly than even your strenuous flus, which illustrates at the very least his poor word selection, given that a disease can't be strenuous. Severe, yes. Strenuous, no. Either the hoax proponent denies that Trump knew what the tapes show he knew, in which case he has to explain why Trump went along with a partial shutdown of the same economy that he has so vigorously advocated opening up fully, or the hoax proponent accepts that Trump knew what the tapes show he knew, in which case he cannot seriously continue thinking of the pandemic as a hoax. Ultimately, however, I cannot force such a person to accept the reality of the coronavirus, even by citing Herman Cain's death from it, or the recent White House announcement of President Trump's own contracting of the disease, which occurred after I had written this but before I had recorded it. Alas, convincing the unconvincible is not one of my superpowers. But I want to explain why the wearing of masks, along with social distancing and avoiding large groups of people, especially indoors, accords with the fundamental values I gave in my second politics video for voting Democratic. In the course of doing so, I'll also explain why being told to wear masks isn't part of a liberal plot to prevent conservatives from exercising their constitutional rights, but is instead a reasonable public health measure that responsible citizens should observe. To begin with, recall the first of my three fundamental values. I want to see the maxim, love thy neighbor, put into practice throughout society. I want policies to be followed that show that we care about other people's lives and well-being, because I do care about other people's lives and well-being. Of course, that's not entirely altruistic of me. I do think that when society is so constructed as to put into practice policies generally conducive to its constituent individuals' continued life, and generally benefiting its constituent individuals' well-being, it also aids me in my continued life in pursuit of my own well-being. We're in this together, and I want social policy to reflect that. So I'm not entirely being interested in the other guy. I'm being self-interested too. But one can be self-interested while still caring about other people's lives and well-being. Anyway, that's what people do when they wear masks. Not only do they preserve their own lives and pursue their own well-being, but they show that they care about other people's lives and other people's well-being. Or if they don't care, they at least show that they are willing to follow social rules whose purpose is to protect other people's lives and well-being, which, as it happens, also protect their own lives and well-being. As it turns out, your wearing of a mask actually does give you some protection against the coronavirus. Quite a bit, in fact. More than was initially thought. Not only does it substantially lessen your probability of contracting the coronavirus, but it makes it considerably more likely that if you do contract it, your case will be mild rather than severe. The reason is that your wearing of a mask lessens the dose of the coronavirus you'll get if you inhale the air an infected person exhaled, and getting a lower dose translates into a milder case. You might even get such a mild case that you won't know you have it. Possibly. So, yes, it's in your own interest to wear a mask. But your mask doesn't only protect you from me, it also protects me from you, at least potentially. We protect each other from ourselves when we wear masks. The key reason for this is that you can be infected but still be asymptomatic. You can be infected with the coronavirus but show no symptoms, so that you're completely unaware that you're infected. Even if you don't know that you're a carrier of the coronavirus, you might actually be a carrier, and then you can transmit it to other people. If that makes no sense to you, look up Typhoid Mary. She was asymptomatic but still spread typhoid until she was finally quarantined from the rest of the population. In fact, a sizable percentage of those infected with the coronavirus really do show no symptoms. I've seen varying numbers on this, from 20% to 80%, but even the lowest figure is a lot, as 20% is 1 in every 5. Now, I don't think that I'm a carrier, and I'm probably not, but I could be. You probably don't think you're a carrier, and you probably aren't, but you could be. The stranger in the supermarket probably doesn't think he's a carrier, and he probably isn't, but he could be. And we know that some people are. We just don't know which ones. But if we all wear masks, then we're all protected from those who really are infected, even if they're asymptomatic. So, in order for us to behave in a way that accords with caring about the lives and well-being of the people living with us in society, in order to act in accord with the maxim, love thy neighbor, while simultaneously protecting ourselves, we wear masks. We're not just protecting ourselves, we're protecting other people too, or at least we potentially are, given that we ourselves might be infected and might be carriers, despite not knowing that we are. For a similar reason, we practice social distancing. We care about each other, so we protect each other from ourselves, knowing that we could, just possibly, be asymptomatic carriers. And in the process, we protect ourselves. A certain percentage of the population really is carrying the coronavirus asymptomatically. We just don't know who's who. So we wear masks because we care about each other. Of course, the fact that wearing a mask also confers a reasonably high degree of protection upon the wearer means that wearing a mask is also the self-interested thing to do. But by protecting other people as well, we're helping put the maxim love thy neighbor into practice throughout society, just by wearing a simple mask. Recall my second fundamental value, seeing the consensus of expert opinion as important. The consensus of expert medical opinion is that wearing masks significantly cuts down the transmission rate of the coronavirus, even if you're in a crowd. Even the Trump-appointed head of the CDC, Dr. Robert Redfield, recently testified that wearing masks might be more effective than a vaccine in keeping us all safe. The reason being that a vaccine might only provoke an immune response in 70% of the population, so that it would only directly protect that 70%. But wearing masks protects all of us, not just 70% of us, if we all wear them. It's not perfect, and it's not absolute protection, but it's good protection. Now, you might be able to find an individual medical expert who thinks that the best thing for us to do would be to open up the economy and let the population develop herd immunity. But the trouble with opting for herd immunity is that achieving it would cost another million Americans their lives, on the most conservative estimate, and probably millions, plural, of American lives. And the consensus of medical experts who care about saving as many lives as possible is quite different. The consensus is that the way to control the coronavirus is by wearing masks and practicing social distancing, as well as taking other steps that the president should have taken and should be taking. Sweden tried the herd immunity approach and lost far more citizens than other Scandinavian nations, without benefiting its economy. Nations that have done best at fighting the pandemic have put into place strict lockdowns, required wearing masks, engaged in widespread testing, and performed contact tracing. We should learn from them. We should discourage, not encourage, needless public gatherings at which people do not wear masks, especially indoor ones. Wearing masks accords with the consensus of expert opinion, and we should always pay attention to the consensus of expert opinion because that tells us what reasonable, well-informed people who know what they're talking about agree is true, or in this case, best. Recall my third fundamental value, placing high value on individual freedom while accepting only very well-justified constraints upon those freedoms, or upon that individual freedom. Wearing masks is a small constraint on our freedom, one with a big reward for all of us. But precisely because of that big reward, precisely because wearing masks does protect public health, wearing masks constitutes exercising our freedom responsibly. The recent Maine wedding, held indoors and at least mostly without masks, was undoubtedly a joyous event, but it also wound up infecting more than 170 people, killing at least 7, making its consequences less than wholly joyous. I'm a big fan of individual freedom, but freedom should always be exercised responsibly, observing precisely those limitations which really are well justified, and only those limitations. I want to be free to wear my hair the way I want to, and I want to be free to wear the clothes I prefer to wear, and not to be told how I may wear my hair or which clothes I may wear. You might want to be free to assemble with other people, perhaps for the purpose of religious worship, or perhaps for a wedding, or perhaps for a barbecue, without being told you have to wear a mask. Nobody likes having his personal freedom interfered with. But in the case of wearing masks, we're saving lives. It isn't just liberals trying to destroy what it means to be American. It's saving lives. Thousands of them. Tens of thousands of them. Maybe more. I place a very high value on people's lives, and I hope that the people around me do too. That is surely a very strong justification for accepting what is, after all, only a very small constraint on our freedom. Don't wear masks and consign tens of thousands of good Americans to their deaths? Or wear masks and save the lives of tens of thousands of good Americans? I don't really have great difficulty choosing between those two. Having to wear masks is not a very large imposition upon us. And if it saves lives, again, if it saves lives, then it's surely worth the cost. It's surely the responsible thing to do. And I hope that we're all taught not only to value freedom, but also to value personal responsibility. I understand the view that we fought the Revolutionary War in order to be free, actually, in order to be free of taxation without representation. And I understand the disinclination to cede even a little of our freedom without a fight. But I should think we would all understand the need to exercise our freedoms responsibly. You might want to be free to drive down the highway on whichever side of the road pleases you. But surely it's reasonable to expect everyone to drive on the same side of the road, as we know that doing so saves a whole lot of lives by preventing a whole lot of needless automobile accidents. A little responsibility goes a long way. So, wearing masks, beyond being in our own interest, shows that we care about the lives and well-being of other people. And wearing masks is recommended by the consensus of medical experts as an important way to save lives. And wearing masks constitutes the responsible exercise of individual freedom. Wearing masks is the rational thing to do, and it is the compassionate thing to do. And it accords with fundamental values that I hold dear, including my supposing people's lives to be worth preserving and people's well-being to be worth promoting. Values that I hope everyone living in society with me shares. Demanding that we all wear masks isn't done to destroy America. It's done to restore America by saving lives and shortening the time until we really can open things up again and get back to normal. It's done to save you and your friends and relatives, and to save me and my friends and relatives, and to save everybody else and everybody else's friends and relatives. It's done to protect the people we care about, ourselves and our fellow Americans. It's the responsible, life-saving, and dare I say patriotic thing to do. As always, may reason and compassion be your guides.